Welcome to the Spencer S. Eccles Health Sciences Library at the University of Utah. We are delighted to celebrate with you the transformation that is undergoing on our own campus. What once was a static warehouse of libraries and print material is now turned into virtually completely digital library, and we are the hub for innovation, discovery, and collaboration across the health sciences campus.
Hi, I'm Jean Shipman, Director of the Spencer S. Eccles Health Sciences Library at the University of Utah. Today I'll be providing a tour of our library that has resulted from many renovations to create a learning space as well as a collaborative and collision opportunity space for many throughout the health sciences campus here at the university. We're standing in the synapse, which is a combination space for many units in the health sciences to be able to come in and use as they need. What this space was our compact shelving for many print volumes of journals and books. The Center for Medical Innovation uses it for their team meetings, for their administrative staff, donors, industry representatives from the community, you name it, they have been in this space. So it's a synapse where people can share ideas, get together, look at group projects, and collaborate to create the new knowledge that the library is going to help curate.
Welcome to the Synapse. My name is John Langell. I'm the Executive Director of the Center for Medical Innovation at the University of Utah. It is my pleasure to be able to introduce you to this amazing space that was created to facilitate partnerships, innovation, and promote creativity at the University of Utah. This dream was created through the Eccles Health Sciences Library, the Health Sciences Center, including the Medical School and the Center for Medical Innovation. The Eccles Health Sciences Library moved forward with their staff to be able to first understand how innovation space works and benchmarks programs from across the country to be able to ensure that we were creating space that would have true impact and where collisions could really occur. This allows us to write on the boards, create major ideas, and then break this space down so that we can open it up to even bigger populations of people. We purposely went with frosted glass walls in this entire space so that we can write on these walls and allow your concepts and your ideas to be shared with others so that innovation truly takes place through collaboration.
What I'm showing you now is our administrative space for the Center for Clinical and Translational Science. This was one of the first areas that we remodeled, and this area was set up like a movie set in that the front of it does look like an entire space is dedicated to the CCTS, but the back is open to our GAP lab, to our Center for Medical Innovation, and to other spaces throughout the garden level. So it's a place where people can come to get help with their clinical research, their research enterprise training classes, and also to get help from a seasoned librarian in getting the best evidence for their research. The GAP Lab stands for Therapeutic Games and Applications Lab, and that is comprised of 22 graduate students from our Entertainment, Arts, and Engineering department. They work on creating medical therapeutic apps for students, for patients, for children, to learn more about their health.
Now some may ask, why the library? Well, I think it's pretty intuitive. Libraries have always connected us together. They've been this pervasive component that's drawn us together to provide education, to provide information, and then to extract the information that we create and to make it available to others. So the libraries had a major role in the synapse. Education, information collection are part and parcel to everything we do, and it's interwoven into the fabric of innovation. Therefore, librarians are interwoven into the fabric of innovation, and without them, we can't do this in an optimal manner.
Hi, my name is Melissa Rethleifson, and I'm the Deputy Director at the Spencer S. Eccles Health Sciences Library. Today I'm sitting on the main floor of our library, and I'm going to show you around. This is our area that we have for our events, our speakers, and of course just for contemplation. Also on this floor is several areas that are designed for studying, both in groups and solo.
We're now in the upper level library, which used to be comprised of stacks of books. We were able to remove those stacks and we moved everything down to the garden level, and instead replaced 6 faculty offices for librarians and also a librarian conference room.
The University of Utah Health Sciences Library is a real leader in collaboration, and we see that this transformation naturally should reside in a core part of our institution, which is our library.